This is 17 News with continuing coronavirus coverage.
Good afternoon, and thanks for joining us. I'm Cole Kitsky. Well, Governor Gavin Newsom is streaming live every day at noon to give an update on the coronavirus crisis in our state. Today, he will lay out parameters California will consider before modifying his stay-at-home order. Let's take a listen in.
We've gone through a series of what I would refer to as pandemic response shifts since we started this journey together late January. The first strategy as a part of our strategy of containment began when we started to repatriate those first flights coming from mainland China, from Wuhan and elsewhere. The second phase was the mitigation phase, adopting strategies as we saw the first case of community spread to advance stay-at-home orders for our seniors, to begin the process of closing down our schools, population-based strategies to mitigate spread that included at scale a statewide stay-at-home order, and then the efforts to continue to practice physical distancing. We then started to move into the third phase, a phase that could broadly be described as the phase of surging our system, not only our hospital system, but our alternative care system to meet a potential demand that required not only physical assets, rooms, but also people and protective gear, ventilators, masks, gowns, coveralls, and the like. The next phase, the phase that I want to speak to all of you today about, is a phase that I would frame as an optimistic phase, that we move from surge and we begin to transition into suppression, ultimately on our way to herd immunity and ultimately to a vaccine. But in this transition, where we do see light at the end of the tunnel, where there is a ray of optimism and hopefulness that this too shall pass, it's also perhaps the most difficult and challenging phase of all. And that's to say a lot, because the last few weeks and months have been very challenging for all of us indeed. But this phase is one where science, where public health, not politics, must be the guide, where we must be open to argument, interested in evidence, where we cannot be ideological in any way, shape, or form in terms of how we approach a condition that changes on an hourly and daily basis, conditions that will ultimately determine what better decisions we make in terms of that transition. So today we want to create a framework and pass forward a process that we've been having and that we've been engaged in for the last few weeks, and basically pull back the curtain on those private conversations and make them public. So you'll get a sense of the questions we're asking and the questions we need answered before we ultimately can move out of a population approach where we are asking everybody to stay at home to a more individual approach to addressing the issues of suppression in the state of California, and ultimately get us back to that sense of normalcy that I know everybody watching so desperately looks forward to. We have a parameter, we have a framework that will guide our decision making, and we'll make that very public in just a moment when I ask Dr. Angel to come up and avail ourselves, of course, to questions not only from Dr. Angel, but from Dr. Ghaly and others that are present here today. But the framework is predicated on the ability to do 6 things. The most important framework is our capacity to expand our testing, to appropriately address the tracing and tracking of individuals, the isolation and the quarantine of individuals, using technology and using a workforce that needs to be trained and an infrastructure that needs to be in place in order to begin the process to transition. I'll talk more about that, and we'll be more prescriptive in terms of what that looks like. The second phase is maintaining our vigilance on protecting the most vulnerable populations in the state of California from infection and spread. Primarily our seniors, those with immune order issues and specific strategies and interventions around addressing the needs of our homeless as examples of addressing those vulnerable populations as a top priority. Number 3 is addressing, again, the ongoing needs of our hospital and alternative care delivery system to meet the needs of potential surges as we adopt new strategies, as we loosen the stay-at-home orders, ultimately and eventually the prospect of increase infections and spreads. We need to make sure that that infrastructure is protected and to make sure that those assets are well prepared. PPE, not just, again, the masks and ventilators and gowns and shields, but also making sure that we have a myriad of other protective gear for that workforce, and to make sure that we're capable from an ICU perspective and hospitalization perspective to meet any additional surges. The 4th frame is to continue the work that we've been doing on a weekly basis, and that is to engage academia, to engage our research partners, to engage those that are on the front lines, and they happen disproportionately to be here in California, companies like Gilead, companies like Genentech, credible operations of support that are coming from our hospital systems, UCs, Stanford, USCs, Scripps, and others, including our national labs, to make sure that we're really advancing and continuing to promote more protocols on therapeutics, which are profoundly important as we bridge ultimately towards the herd immunity and the vaccine within, we hope, the next year or so. Number 5 is the incredible importance of redrawing our floor plans. And that is quite literally a responsibility if we are moving into a next phase of our businesses so that we can practice safe physical distancing within the premise of a business, within and around a school site, and facilities large and small, public and private, all throughout the state of California. So quite literal strategies, guidelines, and expectations on what physical distancing would look like within those facilities, not just broadly out on the streets, our parks, playgrounds, and in our coastlines. And finally, our capacity always to turn on that faucet again and reinstate more vigorous controls. And that's just a process that will perhaps be the most challenging if indeed we lean in, but we have to then lean back out as we toggle from stricter to looser interventions, back and forth. As things change, as data comes in, as health concerns make themselves real in terms of that data, or at least more obvious, our capacity to pull you back in and to encourage people to advance the social distancing, the stay-at-home and physical distancing that has gotten us to this point today. And so that's the framework. Those are the 6 frames of focus that we will monitor and that we will process as we make the determination through this process of architecting a next phase in this pandemic that we will be processing, at least making more public here today. With that, I want to ask Dr. Angel now to come up. She'll walk through a number of those steps, and we'll try to answer and anticipate as many of your questions as we can in the outset. I'll come back up. I'll talk a little bit more about what normal may look like, because normal is anything but. And I'll be honest and sober about that as it relates to that bridge ultimately towards the vaccine. And I'll just end before I ask the doctor by making this point. I recognize what you recognize. 2 things. That you, individuals, through the extraordinary behavior, millions of you, because you have practiced physical distancing, the stay-at-home orders, you have bent the curve in the state of California. The models have changed because of your behavior. And that puts us in a position to be able to socialize, again, to make public these private conversations we've been having about this next phase. But number 2, we do so soberly, because today we had a record number of deaths that we are reporting, 758 individual stories, families, and lives torn apart, 71 individuals that lost their lives just since the last reporting that I gave you yesterday. We are sober about the fact we're still seeing an increase, modest though it may be, in hospitalizations, but also the total number of individuals tested, that we are not out of the woods yet, and we are not spiking the ball. But we also extend a recognition in that light that this can't be a permanent state. And I want you to know it's not. It will not be a permanent state. We recognize the consequences of these stay-at-home orders have a profound impact on the economy, your personal household budget, your personal prospects around your future. If you've just lost a job or you lost wages, or you're struggling with your dream, and that is to keep your dream afloat as a business person that may have put everything on the line, and you were talking about the next 5 to 10 years on that journey and how vulnerable, because of the stay-at-home orders, those dreams are to this new reality. We recognize that the stay-at-home orders impact all of us differently. Certainly impacts those of low income differently than people with means. It impacts communities differently depending on the resources within those communities and the capacity for community members to all come together and help support one another. It's limited in certain parts of our state. And, of course, the impact to the healthcare system. They've done such a magnificent job, not just anticipating a surge, but decompressing their own system, creating slack. And that's had a profound economic consequence on our healthcare delivery system, not just the hospitals, but primary care physicians, surgical operations, community clinics, and the like. And if this were the new normal, those systems would be devastated in a way that would be difficult, even if there's a strong V-shaped recovery, to recover any time soon, and could actually create more health problems down the road as we continue to delay elected surgeries that no longer become elected surgeries, or we're not doing our checkups and preventative work that ultimately become acute care issues. Again, all of these things we recognize require us to begin to at least make public our thinking as we transition from surge to suppression and ultimately bridging towards herd immunity and immunizations. And so with that and vaccines, we look forward now to the presentation of Dr. Angel and then, of course, all your questions.
Well, I'm now going to talk with you about the 6 indicators for modifying a stay-at-home order here in California. To be very clear, this is not simply about a set of indicators where we check and we move on. This is not about a turn-off and a turn-off. This is a thoughtful process about how we modify our policies so that ultimately we protect the health of Californians. And I'll share with you now how we're thinking about each one of those indicators, which we'll be assessing over time and which we're working hard to make sure that we have all of the provisions in place that are necessary to make people healthy. So first of all, the first indicator that we're looking at is the ability to monitor and protect our communities through testing, contact tracing, isolating, and supporting those who are positive or exposed. A couple of the key questions we'll be asking ourselves is, for example, how prepared is our state to test everyone who is symptomatic? This doesn't mean that we can't take action before we have entire testings available for everybody across every place in the state, but is something that is essential for us to understand as we think about what kind of modifications are appropriate. Another example is, do we have the ability to identify contacts of those who are positive to reduce further transmission? Again, this is talking about how we are able to contain the further spread of infection when we identify it in the community, as soon as we identify it in the community. And this will be essential and important as we think about creating more opportunities for movement in the community, more opportunities for infection, and unfortunately also more opportunities for potential movement of COVID-19. Number 2, the ability to prevent infection in people who are at risk for severe COVID-19. A couple of the key questions we'll be asking ourselves and assessing carefully in our decisions around this include, are older Californians and the medically vulnerable living in their own homes supported so that they can continue appropriate physical distancing? Across the state, we have over 6 million older adults who are either isolating in their home or maybe in congregate setting, and every one of them deserves the support they need to be able to stay safe in their own home. And we're thinking carefully about how we together, working with the state and at counties, have the ability to make sure that we assure that these older adults in their homes or who are medically at risk are kept safe as we move forward and think about modifications. Have we developed a plan to quickly identify and contain outbreaks in facilities, older Californians, those living with disabilities, and those currently incarcerated, and those with comorbidities? Specifically, again, this is the congregate settings where we know people are living. We've done a lot to put programs in place that help identify when there are outbreaks, that help provide resources immediately to those settings, and also address some of the very difficult staffing questions. But there is more work to do, and over the coming weeks, we'll be focusing heavily on that to make sure that as we lift again and make it available for people to move, that doesn't put these populations at greater risk. The ability of the hospital and health systems to handle surges. As I mentioned, as we start to loosen up, there is the possibility for more movement of COVID-19, and we need to make sure that our hospitals are prepared for that. Some of the key questions we'll be asking ourselves include, do we have adequate bed capacity, staff, and supplies, such as ventilators and masks? Over the past few weeks, you've heard again and again all of the hard work we've been doing across the state, both locally, but particularly here at the state, for procuring increased masks and making sure that we have the number of ventilators we need to make sure that if we rely on our care delivery system and if we need those ventilators, they are available to us. We've made great progress. We will continue to watch this, however, because this is a very important area as we think about how we modify our interventions. And can our healthcare system adequately address COVID-19 and other critical healthcare needs? This reminds us once again that while our care delivery system is very well situated at this moment to deal with the amount of cases that we are seeing, it hasn't been necessarily providing the kind of care that we do for our regular healthcare maintenance over the time, because much of that excess capacity has been developed by canceling elective surgeries, for example, or putting off or postponing things that aren't so immediate. We need to move back into a space where we can make sure that people's healthcare needs are regularly met effectively as we think about titrating off some of these interventions. Number 4, the ability to develop therapeutics to meet the demand. We feel like this is an important place for California, of all states in particular, to be engaged in this, because there is so much innovation and advancements in our medical community here in California. So we have a unique opportunity to collaborate and make sure that these therapeutics continue to evolve. They're important, especially in the absence of vaccines, because they allow people, if they do get sick, to recover more quickly and also not to end up in our care delivery system and put more pressure on our care delivery system. This is an opportunity to save lives and for individuals and make it safer for our community at large. So some of the key questions and activities we'll be engaged in include, have we built a coalition of private, public, and academic partners to accelerate the development of therapeutics? And have we identified potential therapeutics that have shown promise? We're already on our path here. We'll continue to do work here, and we'll continue to watch it as we assess changes. The ability for businesses, schools, and childcare facilities to support physical distancing. Some of the key questions as we think about enhancing this includes, have we worked with businesses to support physical distancing practices and introduced guidelines to provide health checks when employees or the general public enter the premises? These are opportunities to think about, how are we shaping the physical environment as we go out into those different places, from businesses to our school environment? How have we shaped it so we've basically engineered in the opportunity to stay 6 feet apart? That means we can spend less time trying to avoid bumping into one another, trying to avoid potentially exposing one another to COVID-19, and more time focusing on getting our work done and going about our daily business. And also, do we have supplies and equipment to keep the workforce and customers safe? These are areas that we'll continue to explore, particularly as we are more established in the resources that we need for the care delivery environment and to protect our frontline workers. These are opportunities that we have to shift in the future to focus more on these areas to make sure that others can be safe in other places as well, and that those resources can be broader as we begin to spend less time in the home. The ability to determine when to reinstitute certain measures, such as the stay-at-home orders, if necessary. This is the last but an incredibly critical indicator for us. And some of the key questions that we'll be talking about are we tracking the right data to provide us an early warning system? And do we have the ability to quickly communicate the need to reinstate these measures? We need to have a clear process in place so that we understand not only when we're making great progress, but also when we need to take a step back, think about the interventions we have, modify them, and perhaps even institute broader recommendations once again. This will be an important point to moving forward in a way that's sustainable for California. I just want to end noting that, as the governor had mentioned in his opening remarks, this is a conversation about modifying, about transitioning from where we are now to a point in the future when COVID-19 no longer poses a threat to our population. That time period, this time period that we're entering, is not about going back to where we were before. It's about going forward in ways that are healthy for all of us. But it won't look the same. Different ways that we will think about the way we do our everyday work will mean that we'll be making changes.
You just heard the latest from Governor Gavin Newsom, who is talking about what is being done here in the state to determine when we can reopen. Now, he did mention in a quote, he said this cannot be a permanent state and won't be. That's regarding the stay-at-home orders. Now, they are looking to permanently lift those orders at some point, but they are working right now to answer questions in the meantime in order to get us back to what life was kind of like. Things will never be the same. They did mention that, but they said we will be taking precautions as necessary to build the immunity during this time. They will be looking and helping to care for the sick and to prevent the infection in those who are at high risk. Also, they want to build capacity to protect health in the public. Also, reduce social, emotional, and economic disruptions. That is all what they are doing, and they are looking at everything in order to determine when the stay-at-home orders can be lifted and things can go back to normal. Well, stay with us. We will be back with more news after this. Welcome back now to the latest on the coronavirus here in Kern County. Kern Public Health announces new coronavirus cases. The total is now 470. That's 16 more since yesterday evening. Nearly 3,900 people have tested negative, and more than 2,700 people are still waiting for their results. 3 people have died. Well, today, Public Health reminding everyone to stay at home and maintain social distancing. And according to Public Health, they received 330 calls into the call center yesterday. They say the biggest question people are asking is homemade hand sanitizer safe? They're reminding you that you should use things that they recommend and make sure to follow the guidelines. Well, now to an update on a murder and kidnapping that started last Sunday night in Lamont. This all started around 8:30 Sunday night. Deputies arrived at a home on Florence Street in Lamont and found 34-year-old Adriana Rivera, who had been shot. She was 7 months pregnant. Rivera was transported to Kern Medical, where she died. According to Vidal's family, the baby is in the NICU in Madera. Deputies say Javier Vidal had kidnapped his 2-year-old son. An Amber Alert was issued, and later that night, the little boy was found safe. 17's new cameras were captured in the gun battle between Vidal and the sheriff's SWAT team. The 36-year-old Vidal was pronounced dead at the scene around 4 a.m. Well, now to a standoff where a mother accused of threatening to shoot her 3 young children. This all happened at 4:30 yesterday afternoon. Deputies say they were called to reports of a family disturbance at a home on South Union Avenue, across the street from the county fairgrounds. When they arrived, deputies were told a woman, now identified as 28-year-old Angelica Torres, inside the house threatened to harm her children, who were described as toddler age. KCSO says the kids and other family members left the home, but Torres remained inside. She eventually surrendered and was taken to Kern Medical to be treated for a self-inflicted cut to her arm. KCSO says the weapon turned out to be a replica firearm. The 28-year-old is being held on $27,000 bail and is set to be due in court on April 22nd. Well, child abuse reports have dropped across the state, and experts warn that's not a good thing. They say it's likely because the stay-at-home orders don't give community members or teachers the chance to observe children and notice when there could be abuse or neglect. If you suspect child abuse or neglect, you can call or report to 631-6011. Well, a fire in Oildale claims the life of a local woman. The flames were first reported in a mobile home on T Lane around 8:30 last night. When fire crews arrived, the home was engulfed in flames, and there were reports at least one person was trapped inside. Nearly 24 firefighters worked quickly to put out the fire. They searched the home and found one person dead inside. The name of the person has not been released, but according to the victim's sister, she was 72-year-old Judy Gregg. County fire arson investigators are trying to determine the cause of that fire. And another fire also in Oildale. Kern County and Bakersfield fire crews were called out to an abandoned home in Oildale near the corner of McCord and Avenue in Oildale Drive around 4:45 this morning. No one was hurt, no word on the cause. An investigation is underway, and we will continue to update you with the latest information as it becomes available. Stay with us. We're back after this.
Nicole, it is a beautiful start to the afternoon. I've made my way outside to my back patio to relax because we've got such a nice sunshine out there. The temperatures are starting to warm up. Arvin right now 73 degrees under sunny skies, and we're looking good in Wasco as well. 72 degrees on the temperature. Fraser Park, sunny skies, 52 degrees, and we take a look at Golden Hills, a beautiful start to the afternoon, and 57. Here's a look at other temperatures right now, and we've got 70 in Wasco, lower 70s all around, and then 50s and 60s into the mountains, 63 in Mojave. No rain, just clear skies, and that's the way we're going to keep it today and to tomorrow. A little bit of a change, but nothing happening right now. You can see the clouds have even shrunk out near the Channel Islands, so a sunny day all around. High pressure and control here, that will help to warm us up the next few days as well. And then we'll be looking for some changes, but not until probably Friday. So near 80 on Thursday for us, and then a weak system brushes the area on Friday, looking between a trace and 600, 7-inch. The 600s would be probably in the mountain communities. We get a break on Saturday, Sunday, and then another system will bring another chance of rain by the early part of next week. But for today, enjoy it outside on your back patio, maybe barbecue tonight. 77 in Bakersfield, 76 in Delano, 75 in Buttonwillow, and then for the mountains in the Kern River Valley. 59 in Fraser Park, 61 in Tehachapi, rainier 70 for the Kern River Valley, and then for the desert, we're looking sunny today and a high of 66 in Mojave. Your extended forecast, 79 tomorrow, 81 on Thursday, and then you can see the change Friday and also into next Monday, but still warm with those 70s. And then for the mountains, we're looking sunny through Thursday with upper 60s, a chance of a shower Friday, and then again next Monday, and you can see a little bit of a cool down. And then for the Kern River Valley, look at the warm up tomorrow, 73, 74 on Thursday, and then we moderate those temperatures a little bit for the weekend. And you also have a chance of a shower Friday and into next Monday. So follow my lead, Kern County. Get out into the backyard, enjoy this beautiful weather, and this is the way it's going to be at least for the next few days. So I hope everybody enjoys it. We'll be right back right after this.
Well, face masks and plastic gloves have become a must-have item when people go out in public during the coronavirus pandemic. But after being used, some of that personal protective equipment is being dumped on area streets, parking lots, and even waterways. Environmental and health officials worry the potential contamination items could pose a threat to anyone who picks them up. Well, good news for people who plan to visit wineries in Northern California this spring. The industry there is holding virtual tastings. 7 businesses in Sonoma and Napa are giving people the wine country experience from the comfort of their own homes. Those interested can purchase the wineries tasting kits online and then join virtual tours to replicate the guided tastings. Stay with us. We're back after the break. Mobile-only streaming service Quibi said they had more than 1.7 million downloads within the first week of launch. Quibi features videos 10 minutes or less and only available on your phone. It's all original content too, from documentaries to comedies, along with scripted series and new programs. Well, singer and rapper Pitbull has a new song out that offers hopeful amidst the coronavirus outbreak. It's called I Believe That We Will Win. According to his Instagram, proceeds from the song will go towards COVID-19 relief efforts. Stay with us. We're back after this. Taco Bell wants to remind everyone we're all in this coronavirus fight together. It's giving away free Doritos Locos Tacos for the 3rd week in a row. Taco Bell CEO started the Free Taco Tuesday last month. It's a thank you for everything communities are doing to help out.
This is 17 News with continuing coronavirus coverage.